everybody to this fifth episode of our webinar series. Today we'll speak about the impact of the COVID-19 on the indigenous peoples. And first of all, I would like to warmly welcome our speakers today. And I will start with Daqui Lema. He has an MA degree from University of Padua, a degree in human rights and multi-level governance. He's also a professor of international law, human rights, and interculturality at the School of Law of the Pontificia Universidad Católica de Ecuador. Daqui is a member of the research group on human rights and social issues, and also a member of the research project Learning Methodologies of Quechua Language. He's also involved in the NGO sector. He's the secretary of the Cabildo Quechua de Otavalo and the cultural activist at local level. Our next speaker is Claire Wright. Claire has a PhD in contemporary political processes from the University of Salamanca, and she's a research fellow at the School of Law, Queen's University in Belfast. She and Alexandra, our third speaker, are co-editors of a recently published book, The Prior Consultation of Indigenous Peoples in Latin America, Inside the Implementation Gap. It was published by Routledge in 2019. And finally, the third speaker is my dear colleague, Alexandra Tomaselli. She's a researcher, a senior researcher here at the Institute for Minority Rights. Since 2004, she has worked in several EU-funded research and international cooperation projects in Europe, Latin America, and Southeast Asia. Alexandra is also a member of the International Law Association and of its Committee on the Implementation of the Rights of Indigenous Peoples. And before we start, I would like also to welcome and thank my colleague, Johanna Mitterhofer, who is basically in charge with the moderation of the chat. So I will warmly welcome also the participants, and I will advise you to already, if you want, start asking questions if you have them ready, or to also post your questions on Facebook, because we are live streaming this on Facebook as well. And finally, I would like to introduce myself. My name is Sergiu Constantin. I'm a senior researcher at the Institute for Minority Rights here at the Eurac Research. And I would say that without further delay, we can start. And first, just a brief outline of the webinar. We will start with short introductory statements of our three speakers, 5 minutes, more or less. Then hopefully we'll have a quite lively, vivid discussion. And so I'm looking forward to receive questions from the audience and to basically have a free flow of ideas regarding the topic of the day. So without further delay, I would say, Daqui, you have the floor.
Thank you very much. Thank you for this space and this opportunity to share some considerations about this context of coronavirus and indigenous peoples in Ecuador. To understand what's happening right now, we should have a brief consideration of the events of last October, of last year, because in this space we found an important break between government and national indigenous organizations, CONAIE, which is the most representative institution here in Ecuador. Especially this break was realized in front of the impact of 883 decree. This decree was directed to cut false subsidies, and in this way impact in a negative way to agricultural producers. And the response of government was a response with violence and repression against indigenous demonstrations, occupying also indigenous territories in some cases. The response of indigenous peoples and in communities was to unauthorize these kinds of presence, and in this way improve the control in their indigenous territories. So we have this precedent that was this has been very important in order to respond also to the local management of this health emergency, because right now indigenous peoples are responding, closing their communities, and also with different kind of decisions. But we should also have a distinction, because there are different contexts of indigenous peoples here in Ecuador. For instance, in urban area, we find some important problems, for instance, in the not recognition of local authorities, local indigenous authorities, by COE Nacional, which is the institution, the national institution in charge to manage this health emergency. So there is not a coordination between local authorities in urban and national authorities, in this case COE Nacional, but also problems as, for instance, in economic, because there is not more tourism, and it's a very important issue for indigenous living in the urban area. The second case, for instance, the rurality, indigenous living in rural areas. This case is maybe most positive case, because, as we said, there is an improvement in the management of their autonomies. There are also activities. For instance, indigenous communities are organizing their own markets, because usually they recur to urban area to sell their products, but right now they are organizing their own markets. It means improve also their economic in their communities. They are practicing, for instance, barter, and the control of access to people that are not of their communities. But perhaps the most negative situation is the situation of indigenous peoples living in forests, because there is a completely absence of state, and the only presence that we can find is the activity related by not governmental organizations or foundations. This is a case of, for instance, of Chachi nationality in Esmeraldas in the north of Ecuador, or also Siecopay. The last one, Siecopay nation, represents around 100 peoples, and in this community there was found two confirmed cases of coronavirus. It means that there will be a very important impact in their health, but, and we consider also the possibility that it brings to their disappear this community, because it's very a complex situation to them. In this context, as we say, the break between CONAI and government continue to be very important. And this 1st June, CONAI had different decisions. The first one is continue to the quarantine until 15 June, because right now the government is opening all activities with some forms of control, but right now we are opening everything, but communities decided to continue in this enclosure, to continue the quarantine until 5th June. The second decision was to the progressive participation in the demonstrations organized by workers, students, and workers of public institutions, because right now we have important cuts in the resources destined to, for instance, to universities. So it's a very important question that we are trying to change with the demonstrations. The third decision made by CONAE is to improve the coordination between education minister, the Minister of Education here in Ecuador, because indigenous communities are not able to participate in national programs of web education. And in most of the case, students should walk far from their communities to access to internet. So this context exposed the indigenous youngs, the indigenous students, to coronavirus, and this is a very important problem. The last one decision is to that CONAIE decided to continue the celebration of the 3rd anniversary of the first indigenous uprising here in Ecuador, because this historical event represents an important context for the recognition of collective rights and the adoption of the last constitution that is in coordination, or I mean, find a lot of rights present in the UN Declaration of Indigenous Peoples, or also the ILO 169 Convention. So this context is very in one sense dangerous in the case of health, but also we continue with demands against government, especially in the field of collective rights.
Okay, thank you very much, Daqui, for this overview on the situation, current situation in Ecuador. And you already, I think, outlined some of the specific challenges that the indigenous peoples are facing, not only in Ecuador, but in general. And I think now we are ready to move, and Claire, you have the floor.
Thank you very much. Well, first of all, I'd like to congratulate Eurac for organising a series of webinars, and particularly this webinar, which I've been very happily invited to. And thank you very much for the invitation. My perspective here is obviously going to be as an external actor to the community. So all of my comments, all of my information is kind of given and offered in good spirit and with humility. And I hope to learn things today as well from your comments and questions. I've already learned from Daqui. And I have two main topics that I'd like to discuss in 5 minutes, which isn't long. One of them, the first one, is how the pandemic has exacerbated existing inequalities in indigenous communities. That's the first topic. And the second is how government responses might be exacerbating violence suffered by indigenous communities. I'll refer mainly to Mexico and Colombia. I don't manage to go much beyond Latin America in my analyses, I apologize for that. But hopefully with a few illustrative examples that should help. So first of all, in terms of how the pandemic has exacerbated existing inequalities, I think it's a really important move that many international NGOs, international organizations, multilateral development agencies, even the press, have called attention to the situation of indigenous peoples and communities during the pandemic, and specific situations of inequality and marginalization that are getting worse. And I think that's important because it's not been like a sort of cloud of invisibility. There has been invisibility given to these situations. I think many of us are aware of the structural inequalities faced by indigenous peoples and communities. Specifically in the context of the pandemic, obviously healthcare is very important. And we know that indigenous people living in communities suffer from a lack of access to healthcare. Sometimes hospitals are very far away. The ratio of doctors to people is a lot lower than in other areas. And obviously during the pandemic, this has become exacerbated. In the case of Mexico, even though indigenous people are less likely than non-indigenous people to get the virus, they're more likely to die from it, nearly twice as likely to die from it. And this is due to underlying health factors created by these structural inequalities, as well as a lack of access to decent healthcare. So obviously that's the main concern, I would say, in the first instance, healthcare, how inequalities relating to access to healthcare are being exacerbated in the pandemic and becoming more obvious in the pandemic. Another issue is the question of information that's culturally appropriate and in indigenous languages. There were many criticisms of Latin American governments, particularly at the start of the spread of the pandemic, about the lack of information on indigenous peoples and the virus, and then for indigenous peoples about the virus. Both the Mexican and Colombian governments have now offered quite substantial information in different languages. I believe the information isn't completely comprehensive in terms of content and languages, but there are specific efforts. And the Mexican government now has a mapping of indigenous regions, the amount of people who've been affected. La UNIC, the National Organization of Indigenous Peoples in Colombia, are doing the same. So there is a degree whereby there's kind of been improvement in learning in terms of information, culturally appropriate information, but at the start there seemed to be quite a degree of misinformation and lack of information, which is obviously a government task. In terms of other structural inequalities that have become worse during the pandemic, the access to work and to food security obviously are suffering because of the measures of lockdown. Indigenous people, as many people throughout Latin America, particularly indigenous people, work in the informal sector. So if you can't go out, you can't work, and you can't eat, and you can't earn a living. So this has become a big problem. And obviously the idea of help and social security varies greatly throughout Latin America. And in terms of food, one issue that's been mentioned by indigenous peoples both in Colombia and Mexico, in Guerrero, Mexico, and La Guajira in Colombia, is a lack of access to clean water, drinking water, and in fact water to be able to wash your hands, which is a basic response, you know, to try and stop the virus. So as well as not having food, work, and a lack of access to drinking water, clean water, these are problems that have become exacerbated in the pandemic. I think I don't have much time, but I'm going to quickly on the next 2 points I wanted to make in terms of social inequalities in the pandemic. Another issue is violence against women and the situation of women, particularly during the pandemic. And again, in Mexico, lots of concern has been raised about the position of women in their homes who are a bit isolated, maybe suffering from violence. And in the case of Mexico, unfortunately, there's been a defunding of certain areas, including they're called CAMIs, the Centers of Attention for Indigenous and Afro-Mexican Women. So a couple of them are closing, and this means a really vital lifeline for Indigenous women facing this during the pandemic has been shut. So that's another problem. And then there's a whole issue that I would highlight of the relationship between Indigenous people and migration. We know that throughout Latin America and throughout the world where Indigenous people live, there have been sort of, waves of migration to urban centres to look for work. Obviously, in the context of the pandemic, this is a concern because people return to their communities and the communities are worried they may have the virus. So quarantine becomes difficult. That's one issue. Another issue is because of the lack of food and the lack of work in the communities, people are migrating perhaps more than they used to. There's cases again in Guerrero of younger people migrating because there's no classes, no schools, so they're migrating to work. So that's a problem. At the same time, Indigenous people who've migrated to the United States are no longer sending money or remesas back because there's high unemployment rates in the States. So migration is a whole sort of difficult issue for Indigenous communities and migrants living in cities. There's cases both in Guadalajara, in Mexico, in Bogota, and Colombia, whereby Indigenous migrants in cities can't access sort of basic labour rights because of a lack of basic things like a fixed address for over 3 months or something like that. So that I would say is a massive issue, Indigenous migration and the pandemic. Do I have 1 minute to talk about the other topic? There we go, thank you. The other issue is about how governmental responses may have exacerbated violence in Indigenous communities. We know that lots of Indigenous communities live on lands that are under conflict, whether it's because of illegal crops, the access to natural resources by extractive industries. And the Special Rapporteur of the United Nations on Indigenous Peoples did a press release in May about this, saying that he was concerned that under states of emergency, Indigenous peoples will be suffering high levels of violence. And this does seem to be true in certain instances and for certain reasons. One is that the existence of mega projects, these big projects to exploit natural resources or build things, are still going on. The case of the Tren Maya in Mexico is still carrying on, despite a general lockdown in Mexico. Another issue is the militarization, sending military personnel to protect, in inverted commas, Indigenous communities, like has been the case in Colombia with its border on Brazil and Peru. But there are obviously clashes with local people and the military for obvious reasons. And finally, this is particularly the case in Colombia, but I don't think it's unique to Colombia. Violence caused by, extra state or non-state actors, and maybe state actors, but mainly non-state actors, who are using the pandemic as an opportunity to sort of target certain people that would be difficult to target otherwise because they can't move, they're in lockdown, they're sitting ducks. And also they're trying to get through the lockdown by threatening Indigenous sort of police forces. So I think these are two really huge, important issues. There's a lot more to say, but I wanted to sort of put them on the table at the start. So thank you very much.
Thank you, Claire. I think you really managed to squeeze in a few minutes, basically, I think the main issues that if I really manage to like summary and give a summary of what you said. So basically the main obstacles are obstacles to access food and water, obstacles in terms of access to healthcare. Then you have the human rights violation, and finally the obstacles in accessing information regarding the pandemic in Indigenous people's languages, more or less. This is it. Okay, so thank you again for this overview. And yeah, Alexandra, now you have the floor, please. Thank you.
Thank you. I also would like to start by thanking my colleagues at the Institute for Minority Rights at Eurac Research for all the efforts in setting up and running this series of webinars. And of course, a special thanks to Claire and Daqui for joining us in today's webinar. And I I would have also 3 main points, partly retaking what Daqui and Claire have said. My first point relates also to the issue of health and access to food, which in the case of indigenous peoples in many areas of the world is increasingly becoming a reality of food insecurity. And we know this is a pandemic that is a global health emergency, but in the case of indigenous peoples, as well as in other vulnerable sectors of the society, the situation is getting really dramatic. And as Claire said, this is mainly because of the structural inequality that have been suffering from well before the outbreak of this pandemic, and often in combination with the lack of infrastructures and also the lack of provision of or access to basic needs and services. I like to stress that this happens both in less economically developed countries, but also in those that are well developed countries. Let me give you some empirical examples of what is happening now under these pandemic times to indigenous peoples. So as already Daqui and Claire have underlined, the Amazon region, as many of you will know, has been identified as one of the hotspots of the pandemic. There live many indigenous peoples, either settled or those that enter into initial contacts, or those that live in voluntary isolation. But in the Amazon region, there are other epidemics present, malaria, dengue, but also the last known chikungunya. And of course, if they don't kill, they weaken the immune system anyhow. And just to give you a data, in the Amazon basin, only 9 hospitals serve for 3 million indigenous peoples. In Brazil, for example, the death rate has been also been estimated to be twice the national official average, as in the case of Mexico mentioned by Claire. And in Peru, IDESAP, the largest association of indigenous communities, has announced a risk of ethnocide of Amazon indigenous communities. So beyond Latin America, there have been cases in the Navajo communities in New Mexico and Arizona due to the lack of access to clean water. So the virus has been hitting hard these communities. In Canada, First Nations, Inuit, and Métis have been recognized to be 3 to 5 times more likely to face food insecurity. But at least the government in Canada has translated the prevention measures into indigenous languages, and to some extent has been present also with regard to aids, food packages, and so on and so forth, also to some extent in the case of Australia. Because as also my colleagues said before, what is really striking, and this is also my second point, is how the state has been really negligent in many cases. And this is the case, of course, in many countries in Latin America. Bolivia, for example, indigenous peoples in the lowlands have received no packages, no vouchers, no food. Venezuela as well. Of course, we're all aware of the Venezuelan crisis, but also we have seen this situation in South Africa with the indigenous peoples in Kenya and South Africa completely linguistically and financially excluded by the government response. The same in India, where indigenous peoples have denounced, the Adivasi have denounced an outbreak of the communication and a total alienation of the communities. And this is particularly disturbing considering that the state is the duty bearer of indigenous rights. And this has been also clarified by the Inter-American Court of Human Rights. And this somehow leads me to my last and third point. So if, of course, we must be aware and concerned of what will happen to indigenous peoples in terms really of health and access to health and let's say also physical survival, which also relates, of course, to their culture as well. What will happen to the exercise of their rights? Because if, let's say, in normal times, those that have been working on indigenous rights have normally witnessed and reported, empirically reported, a huge implementation gap. Now, what is happening now during the pandemic times and what will happen next as also Daqui was absolutely underlined. And I will just bring in one example of how indigenous peoples are brilliantly provided us with an answer. And for example, the One Piece Nation in Peru has decided to sue the company who has been continuing the oil extraction activities, notwithstanding the fact, of course, of the lockdown. They were allowed to continue their activities, but of course, they didn't do it in a proper way, and they decided to file a criminal complaint against this company. And I would like to underline, and then I conclude this statement, by saying that in this block 64, the oil extraction project has neither received the consent of indigenous peoples living there, nor the Peruvian government official green light, which is of course even more worrying. And I will stop here. Thank you.
All right, thank you, Alexandra. Again, I also thank you for bringing in new case studies. Basically, you presented us the situation in other countries that the previous two speakers, and I think I already have a question from the public that is linked more or less to a certain extent to what was discussed before. Meaning the access to information in the languages of indigenous peoples, and also the state response. And the question combines these two aspects. And it is basically whether you have a knowledge of indigenous peoples who have experienced the hardship in relations with authorities because of language barriers, especially if the authorities are not sensitive to indigenous languages in the public communication when they inform citizens about the measures and risks of the pandemic. So this is a kind of general question that can be answered by any of you who have, whether you have specific knowledge about such situations. Daqui, go for it.
Okay. In the context of language rights here in my city here in Ecuador, fortunately we started a process of interculturality in the last 10 years. So in most of the cases, we have information in Quechua and also in Spanish, but also private activities, as for instance, radio actors or cultural actors that contribute to the diffusion of this kind of information. But at national level, what we should consider is the completely absence of the use of indigenous language. For instance, in national communications realized by the president, there is no translation, there is not interpreters and traductors to indigenous language. In this sense, one of the most important risks in this sense is that people don't understand the emergency and the conduct to have in this aspect. Language rights also means to have health assistance in indigenous languages. Because, for instance, if you don't have the information that, for instance, determine that you should be in quarantine, people continue to exit and work and contact with other members of their community, and the expansion of the virus is realized. And so, I think in this case, our state, we declare our state in the last constitution as plurinational, but in the fact we don't achieve this kind of interculturality yet, because it's very clear in this circumstance of a pandemic. Information is a needed instrument to contrast this kind of pandemic.
Any other reaction on this question from, okay, Alexandra, you go first.
Yeah, no, I actually, another thing that is important to stress is that in the absence of the states, there have been luckily a lot of initiatives, also as Claire was saying, from NGOs, but also international organizations, UN, FAO, and also the ILO has been really active. Also private or celebrities such as the Brazilian photographer Sebastião Salgado and his petition to save the Amazon people. But with regard to indigenous languages, it particularly praiseworthy the initiative of the NGO Cultural Survival that has now translated the prevention measures into more than 80 indigenous languages. So for those that are interested, check the website of Cultural Survival.
Claire, yeah?
Thanks. Just a quick thing to add to this is that although governments are increasingly providing information in indigenous languages, one of the issues is if somebody becomes hospitalised in a community and ends up in intensive care, often those hospital units are quite far from the communities in terms of hours and cultural distance. So there aren't always interpreters there, like there could be in sort of more local health centres, and that's a structural problem that's become a lot worse, obviously during the pandemic, because more people are ending up in intensive care.
Okay, thanks. And now I would like to basically link the next question with something that was mentioned earlier by Daqui, this kind of community efforts, basically, to self-empower. Then when the state is absent, the communities themselves take measures in their hands. And the next question points in this direction, is whether there are any effort among different groups, indigenous groups, and if you have examples, efforts of self-empowerment and initiating their struggle for resources, access to information, and so on and so forth. So I think Daqui already gave some example, but I was wondering whether you have a specific example of such, let's say, a self-empowerment of indigenous peoples in the absence of the state action.
Maybe start, right? Okay. In this consideration, for instance, as I said, we have this context of October demonstrations where communities blocked roads. They didn't permit the transit of products or also people in their territories. And it's the same thing that's happening right now to control the virus. So this capacity to permit or not permit the access to other individuals is very important in the sense to determine that they are having a control of their territories. One of the cases that we have, for instance, here near from my city, here in Otavalo, there is a community called Peguche. There are organizing forms of food distributions between peoples that have not access to resource. The question of food security, for instance, has been very important at the beginning of this pandemic, because people was not organized to affront this kind of issue. So the same indigenous authorities decided to find, for instance, resources from banks, or here in Ecuador we have cooperativas. These are more little forms of banks. So they found a lot of resources. In this sense, organizing these bags with food and distributing to people who needed. There was a project also realized by the government, but in the practice, such resources, such food didn't arrive to communities, because in the middle there are important problems of corruption, and in this sense, usually indigenous communities don't enjoy about this kind of resources. Another aspect of this improvement or indigenous organization, maybe we can find in another community from here, for instance, in the aspect of education. The young indigenous leaders, they are organizing themselves to continue with some education processes, for instance, helping the most younger guys in mathematics, or maybe in literature, and the aspects that they can contribute to help this kind of students. So I think this is happening not only in indigenous communities, because also here in urban areas we can see forms of cooperation. I think it's a question related with the common necessity of Ecuadorians, or maybe people around the world. But in the case of indigenous communities, we can see that this open a little bit a space to use such collective rights that we declare in our constitution, and maybe call for the participations to indigenous leaders and indigenous youngs. In the sense, response in an effective way the necessity created by the pandemic.
I would now, if Alexandra and Claire do not want to intervene on this point, I would like to continue somehow linking with what the next question with what Daqui said, because you mentioned the collective rights, the autonomy, and I think there is a kind of agreement that the most successful, let's say, community, indigenous peoples communities in these times of pandemic were those who enjoyed a certain level of autonomy. And the next question regards basically the impact on the territorial rights and the autonomy. What will be, do you think that will witness in the future a kind of regress in terms of autonomy of indigenous peoples? So somebody wants to take over this? Alexandra, okay, you'll go.
Yeah, no, thank you. So, okay, there have been cases of indigenous peoples even sealing off their territories during these pandemic times. I mean, indigenous peoples are not new to epidemics, and they have been facing quarantines also in the past due to other diseases that were coming in with the colonizers. So I heard of cases of in Cunayala sealing off their territory, and also Mapuche to some extent in Chile also, getting back to remote places in the Andes, and in Malaysia also, getting back the Orangay, getting back to the forest. And this of course relates to the autonomy of indigenous peoples, because, okay, as a general, let's say, division, in inverted commas, there are those indigenous autonomies that are legally recognized, that are either entrenched in constitutions or ordinary laws and so on and so forth, and those that are de facto happening on the ground. And these are really many, really many, and especially in remote areas, also in the urban settings. There are many exercises of indigenous autonomies which are not necessarily recognized by law. So I think the epidemic, beyond the health emergency, I mean, hopefully can be, let's say, at least a space for reflection for indigenous people, for getting together and trying to, as Daqui was saying, to enhance their participation and enhance their autonomous status, also the autonomous management, let's say, of their own affairs. And also by doing this, also increasing their say at the state level. But of course, this is really to be seen, and depends very much on how the pandemic will develop. So I wouldn't say anything else on this at the moment. Thank you.
If I can go ahead, in terms of autonomy rights and territorial rights, I would actually be cautiously optimistic about what happens as a result of the pandemic, because it is a time, as Daki's been showing, that it's come of creativity in indigenous communities, and it's a time for indigenous communities to come together and exercise their rights to autonomy and their own decisions about how they carry out the lockdown in the cases where that happens. And so I think it is an opportunity for indigenous autonomy to be strengthened. But there are two caveats I would make about that. One is the case of indigenous communities who are surrounded or touched by violence. Obviously, this is very difficult. This is a very difficult time, probably more difficult than normal. So those cases would be concerning of concern. And another issue is the sort of coordination with the government, you know, the national government, local government, other governments. Because there's been a debate in Colombia about whether the measures have been sort of imposed or accepted. And there's a sort of general discussion about whether really the measures on indigenous communities have been more imposed externally than internally, because it's a general blanket lockdown. And in Mexico, rather, the indigenous communities have decided, you know, how they do the lockdown and when they do the lockdown, etc. So this idea of, you know, coordination, the non-indigenous state respecting indigenous authorities, Another question is, all of these measures, how many of them have been subject to consultations and free, prior and informed consent? Because we're in a state of emergency, rights are restricted, but the right to consultation and the principle of consent are sort of permanent for Indigenous peoples, but really there hasn't been much discussion about that. I mean, we're in Colombia that the government proposed doing digital consultations, but the ONIC again pointed out that 90% of Indigenous territories don't have internet coverage in Colombia. So these are very difficult questions. If there's no sort of possibility for questioning what the state's imposing or suggesting, that's obviously a big challenge for Indigenous autonomy. But I think personally, I could be very wrong, I hope not, but I think this could be an opportunity for Indigenous autonomies to be strengthened.
Okay, Claire, I think I will ask you another question, because it's a question that specifically addresses a point that you mentioned, and it's about violence against Indigenous women. And the question is whether you can expand a bit on this issue, and maybe you can provide also some examples.
In terms of violence against women, we know, I think in most countries, during the lockdown, there have been many more calls from women to authorities complaining about domestic violence, violence at the hands of their partners, obviously. And this has been an issue. It's been consistent in Indigenous and non-Indigenous communities throughout these periods where we're sort of more at home. In the case of Indigenous communities, I know that there is a general concern in international organisations about women and their role in society and the issue of violence during the pandemic, Indigenous women. But in the case of Mexico, this has been very sort of criticised publicly by NGOs because of the defunding of the main instruments or the main centres designed to help Indigenous women particularly in these sort of situations. So as well as the fact there's been an increase in violence, which NGOs are calculating in terms of Indigenous women at home, the issue is that they haven't got access to the sort of help they need, the basic help they would need to be able to sort of get out of the situation. So there's probably more stuck than non-Indigenous women are in the case of Mexico. They point out cases of older women, disabled women who are at a specific disadvantage in terms of this. But I don't have like a case study that I could refer to, but I think it's kind of, it's a general issue that's cropped up during the pandemic and in lockdown. But it's again due to structural situations and inequalities, it's much more difficult in Indigenous communities because of the lack of these centres that really are the main centre for women to have recurrence to when they go through this sort of situation.
Okay, thank you. Now, I would like to come back a bit to the issue of the self-reliance of Indigenous communities and basically the way they can face this pandemic, also using the experience of the past. Alexandra mentioned something before about the fact that these communities dealt with illnesses, I mean, the pandemics that affected greatly their communities, illnesses brought by the colonizers centuries ago. And there's also a sense of like Indigenous knowledge on how to deal with this kind of situation. Now, there are examples in several parts of the world of communities having tradition of self-isolation, and to answer to such crises, and to basically help the community to heal both spiritually and emotionally. And the question is whether what do you think about this? Whether this traditional Indigenous knowledge has a role to play, and it helps to a certain extent the communities to deal sometimes even better with the pandemic? Somebody wants to say something, Liz?
Okay, I will go for that. Okay, what I've been hearing and finding out is that yeah, many communities, of course, also because of the lockdown, have also returned to their villages in many cases, and so on and so forth. And of course, also because they have been so much abandoned by the state and they have essentially no access to healthcare, etc. They are trying to use traditional medicine, especially to reinforce their immune system. So they're using some traditional medicines to, yeah, to ameliorate their health conditions. And also in Latin America mainly, and this has been reported by Myrna Cunningham in another webinar actually, organized by FAO about 1 month ago, and she was saying that what has been also doing by indigenous leaders, particularly women, was to take care more accurately of the food that they are eating. So somehow getting back to the traditional food, which is healthier and has more, of course, more nutrition and in comparison to the food that can be purchased in supermarkets or so. Yeah, if I may actually add something in relation to the security issue, no, sorry, not the security issue, but the violence issue, partly related to what Claire was saying and the question we received before, is that in the absence of the state, there have been a lot of also repressive actions, not necessarily persecuted by the state, but a lot of illegal loggers, for example, and gold miners, for example, has entered into indigenous territories, taking the excuse of the pandemic. And the rate of the killings of indigenous leaders and environmental activists has worryingly increased during the months of the pandemic. And this has been reported in Brazil, Peru, Ecuador, Myanmar, and the Democratic Republic of Congo, to my knowledge. But I think also Mexico has increased the rate of violence. So it's not only gender violence, but also violence vis-a-vis indigenous leaders and environmental activists, which has worsened. So thank you.
Thank you, Alexandra. Yeah, Daqui, please take a floor.
Thank you very much. In relation to indigenous knowledge, just this morning I listened a case in Guatemala where the traditional medic in a community was burned by a local population by the consideration that he was promoting bad ideas about contrast coronavirus. Okay, using traditional knowledge, he was searching to help the community, but in this case, community considered that it was not knowledge, it was not appropriate to contrast the pandemic. So the violence arrived to burn him. I consider that indeed right now we have this kind of clash of epistemologies in consideration of what means health, because if we consider in the Occidental approach, health means only, or maybe is focalized in the health of our bodies, maybe, but indigenous knowledge consider also the spiritual aspects of our existence. So the issue that could be considered in the context of pandemic is that indigenous peoples are responding also in the sphere of spiritual things, or maybe in the context of their traditional considerations about what means health. Not consider this aspect of this cosmovision, or as we say, or epistemology, going against their cultural rights. So the way to react maybe is the consideration that spiritual things or cultural visions about health should integrate in the new consideration related by medicine, by science, and integrate in order to respond to the spiritual requirements, but also to the real health requirements created by the virus.
I'm just going to briefly add something, if I may. That's really interesting what Daqui was mentioning, but a lot of the sort of international organisations and NGOs who've been making recommendations about how the state can help Indigenous communities during the pandemic. One of the main recommendations is to try and make compatible non-Indigenous and Indigenous healthcare and traditional knowledge. And again, I think there are signs that this is being successful in Indigenous communities, and again, this could strengthen sort of the cases for autonomy in those communities. So it is very important. And again, the question of timing, the time and patience of how to deal with things. Indigenous communities have unfortunately, many prior experiences of epidemics and other adverse conditions. So there's a whole knowledge area there, so traditional knowledge and historical knowledge, that surely is helping many of them.
Thank you. Thank you for pointing out both aspects of the traditional knowledge and the impact, or whether this can be useful or not in these times of pandemic. And I think we still have around 10 minutes. So I would like to ask you a kind of general question to all panelists, and to try to basically sum up the discussion today. And the question is whether, on balance, do you think that Indigenous peoples will be strengthened or weakened by this pandemic? What will be kind of general assessment? And yeah, I think we can start maybe in the inverse order from the beginning. So maybe Alexandra, you can be the first to address this issue. Thank you.
Thank you. This is a very difficult question. And yeah, well, let's say that the hope is that, of course, Indigenous people somehow will face the end of this pandemic strengthened. So they will get strengthened by this additional challenge that they have to face. Because of course, like as I said at the beginning, and also the other my colleagues said, Indigenous peoples face already a number of challenges, a number of problems, and especially with regard to land rights, and also the real implementation of the right to consultation, free, prior and phone consent. And so the hope is that I'm personally very concerned on the health situation, and I hope that, Indigenous people will, that there won't be, the human loss won't be too high. And this relates also somehow to another point that I think is very, very important, that of course, as in other places in the world, those that are departing, Indigenous individuals that are departing, are mainly elder. And those are also used to be the recipients of the oral ancestral knowledge of an indigenous community, Indigenous people. And of course, if they are departing, then there will be also a loss, a loss of culture for the younger generation. Of course, I'm not talking in general terms, but I'm really talking in terms of issue of transmission of the culture. So I think it's more in a hope that they will be strengthened by this pandemic. I think they have survived so many pandemics and epidemics in the past, and so many things. And I'm also, as Claire said, I'm an external person. I'm not Indigenous myself. I have the fortune to work with Indigenous peoples and working on these issues. So I really hope that also this time somehow they will make it, to put it like this. Thank you.
Claire, you have the floor.
Hi. Again, although it's a bit early to say, obviously, because the pandemic's still ongoing, things aren't resolved yet, obviously. Again, I would be optimistic about how Indigenous communities can be strengthened as a result of this experience in pandemic, because I believe that lots of governments are kind of inventing the rules now and getting confused about their rules and how they're applied, and they're a bit confused. And Indigenous communities have more experience and more strength in that, so they're more united and there's more cohesion. I think a lot of us who live in countries, so I live in the United Kingdom, we're rather dismayed by our government's response and what that means. So I think in comparison, Indigenous communities have things a lot clearer and have more experience and have and this will mean that they will become strengthened because of this reaction. There's a couple of caveats again that I would make against that, having said that, one of which is the important issue of food security and work. And I'm seeing quotes of Indigenous organisations saying if the pandemic doesn't kill us, hunger will, and that's a real problem. So only if this question of food security in many communities can be resolved will this be the case. And again, another one is the violence. We know that Indigenous communities unfortunately do experience violence, particularly at the hands of external actors. There are certain countries where this is more, this is clearer. I know in Mexico and Colombia there's lots of sort of violence against Indigenous communities. So unless that's controlled in the context of the pandemic, again, that's a big threat. But having made these two caveats, I would say that I think it's a moment for Indigenous communities. Their inner strength is already being shown, I suppose. And so in that sense, they could well be strengthened. But it's a bit, I guess it's a bit too early to say.
Okay, thank you, Claire. Daqui, what is your opinion?
Thank you. I will make my personal consideration in relation with my own identity, because also I'm indigenous. So I should evaluate this context in a more wide view. I consider that we, as indigenous, are confronting a lot of issues since the colonization process, because also we saw another pandemic situations. We also in the actual context, we see violence, we see discrimination, racism, and these kind of issues are something that create a common approach in the continent, and is resilience against these kind of factors. I consider that in this context of pandemic, we will continue to resistance, and a demonstration of this is the fact that, as I said, we are continuing to organize our territories, organize on political or political decisions, and or ways to contrarrest or to respond bad decisions of government. This context of pandemic is just another step of our struggle for a kind of autodetermination, of or a battle for the recognition of our collective rights. In this sense, is another opportunity to continue in this kind of struggle. So maybe a lot of these problems that we had evidence are determined of also by forms of racism, and racism is indeed a common problem around the world. We saw also, for instance, the events in USA, the demonstration in the USA, and defined or is more clear that such kind of approach, realize a sort of distance in order to have a concrete response to common problems. So one of the struggle of indigenous movements here in Ecuador, for instance, is indeed a response to such common problems, because poverty is not only for indigenous, access to food is not only for indigenous, health, good health assistance is not only for indigenous. So I consider that in this sense, as indigenous peoples, we are realizing these kind of battles for the recognition of rights, but it's something also for all the population, as in the case of here in Ecuador, for Ecuadorian population.
Okay, thank you very much, Daqui. And well, I would like to first of all to thank to all panelists for joining us today for this interesting discussion. Daqui Lema, Claire Wright, Alexandra Tomaselli. I would also like to thank to my colleague Johanna Mitterhofer, who managed the chat and helped me with the questions from the public, from the audience. This is basically the end of our first series of webinars, and I'm happy to announce that because of the response, the success of this first series, we decided to continue it. So we'll start a second series of webinars focusing on issues of minority rights, indigenous people's rights, also gender. We also will bring gender aspects into discussion, and socio-economic participation, and so on and so forth. So the second series will start in July, will be announced, the full program will be announced soon on our webpage, in our social media, so the Facebook page of the Institute for Minority Rights and the Twitter account of the Institute for Minority Rights. And so I'm again going to end by thanking everybody, the audience, the participants who ask very interesting questions, and I'm looking forward to continue our conversations in the next webinars. All the best. Yeah.